Hi, my name is Jasmine Williams, and this is case study 5, Vigabatrin. Please excuse the many times I will butcher that word and many more. But Vigabatrin, sold under the trade name Sabril, is a commonly used treatment for epilepsy. This vinyl form of GABA is a known inhibitor of GABA aminotransferase. GABA, an inhibitory neurotransmitter, is often underproduced in patients experiencing seizures. Vigabatrin is an anticonvulsant used to treat epilepsy. Vigabatrin is used in the treatment of seizures by decreasing abnormal excitement in the brain. Even further, Vigabatrin is used to treat complex partial seizures, secondary generalized seizures, and infantile spasms. Some common side effects of Vigabatrin are weight gain, coordination problems, memory loss or memory impairment, aggressive behavior, bronchitis, and some more severe effects are liver failure, visual field defect, and suicidal thoughts. Okay, let's take a break from saying Vigabatrin and focus on epilepsy. Epilepsy is a broad term used for a brain disorder that causes seizures. There are many different types of epilepsy. There are also many different kinds of seizures. Partial seizures, which occur in one hemisphere of the brain, are divided into simple partial and complex partial. Generalized seizures take place in both hemispheres of the brain. We have simple partial, where you remain conscious, and it affects a small area of the brain. You may feel strange sensations. You may experience jerking movements. You usually know that something is happening, and then you often remember that something has happened. Complex partial or impaired consciousness. You may lose consciousness, impaired awareness, and responsiveness, and you may not remember. Generalized seizures are tonic, which you become stiff and or flexed. Clonic, where you experience convulsions. Atonic, you are relaxed. Myoclonic, short muscle twitches. Tonic/clonic, you may begin tonic and then end in clonic, which means you may become very stiff and then very relaxed. And then absent, you may lose and regain consciousness. All right, so we're back at Vigabatrin, but this time we want to focus on GABA neurotransmitters. So gamma aminobutyric acid, I got through that one, or GABA. GABA's primary functions are as a neurotransmitter. It has the structure of an amino acid, and so it is referred to as an amino acid neurotransmitter. It is synthesized from another amino acid neurotransmitter, glutamate, in a reaction catalyzed by the enzyme glutamic acid decarboxylase. GABA is the brain's main neurotransmitter. Where glutamate acts as an excitatory neurotransmitter, GABA does the opposite and tells other neurons to not fire. Almost 40% of the synapses in the human brain work with GABA. Signs of too much GABA include excess sleepiness, shallow breathing, and an increase in blood pressure. Too little or not enough GABA can cause anxiety, depression, difficulty concentrating, insomnia, and seizure disorders. Okay, describe how the knockdown of GABA, Vigabatrin, will lead to the prevention of seizures. I'm going to try to get this right. Let's see. GABA is used to reduce the transmission of electrical signal throughout the nervous system. GABA binds to the GABA receptor. It opens up the receptor and allows chloride to enter. Chloride is a negative ion that stops the electrical signal. GABA aminotransferase, or GABA-T, is an enzyme that breaks down GABA with less available GABA. With less available GABA, the electrical signal can continue to the next nerve since it is not slowed down by GABA. With less available GABA, the electrical signal is transmitted throughout the brain. The GABA-T will bind to the enzyme and stop it from breaking down GABA. This provides more available GABA to bind to the receptor and slow the electrical signal. So with more available GABA, the electrical signal is reduced. This stabilizes the electrical conduction in the brain, which will lead to the prevention of seizures. Let's see. And these are my many sources. Thank you.